Hi there, this is Dr. J at anatomyonthego.com. And so on this video, on the screen rather, is the question of the video. What is the pectoralis major muscle and what does it do? So there's the pectoralis major, commonly referred to as the pec or the pecs, if we're talking about both sides, of course. And the muscle, just like a lot of other muscles, has two distinct portions or various portions associated with it. And so we actually have a clavicular portion or clavicular head. This actually arises or attaches to the medial part of the clavicle. And remember, the clavicle is the collarbone. And you can feel that located actually superior to this muscle, the pectoralis major, on yourself. Then we have a sternocostal portion. This is called that because it attaches to the sternum. That's the breastbone. And then costal cartilage. Costal refers to ribs. So the attachments here are the anterior surface of the sternum, costal cartilage, so that's the cartilage associated with the ribs, and then also connective tissue associated with the external oblique muscle. You can actually see the oblique there. The connective tissue associated with that, just medial to the oblique, which is located just next to the rectus abdominis. You can see the six-pack muscle right there. The oblique then is lateral to that, kind of like the scissor edge muscle there. So two distinct heads, and the two distinct heads have distinct contributions to the actions of the muscle here. Then the insertion of the muscle is actually the lateral lip of the bicipital groove. So we actually have two structures on the humerus. One is called the greater tubercle, the other is called the lesser tubercle. Between the two, we have a groove created called the bicipital groove. And the biceps tendon actually passes right through this groove, and that's why we call it the bicipital groove. So then we have a lip created just lateral to this groove, and that's where the pectoralis major actually inserts. And then it pulls on the humerus when it performs its action. The actions are, collectively, flexion of the humerus, adduction, medial rotation, and then it pulls the scapula forward. So flexion of the humerus is basically movement of the humerus anterior or forward. And that's achieved primarily by the clavicular portion of the muscle of the pectoralis major. Then adduction is movement of the humerus toward the body. Medial rotation is rotation of the humerus toward midline. And then scapular, moving the scapula forward is pretty self-explanatory. But on yourselves, if you'd like to visualize medial rotation, hold your arm out in front of you, then bend your elbow, and then rotate the palm of your hand toward midline. That's a good way to visualize medial rotation. So the last three actions there are achieved by the sternocostal portion of the pectoralis major. So on the screen you can see the proximal part of the humerus. This is the anterior part of the humerus. And there is the lesser tubercle. And then right next to it is the greater tubercle. Between the two, we have the bicipital groove. And that's actually the lip of the groove is where the pectoralis major inserts. And then it pulls and performs its actions there. So on the left, you can actually see the lateral lip of the bicipital groove. And that's where the muscle inserts. So ultimately then it performs its action when it pulls there. And so we have then the actions of flexion of the humerus, adduction, medial rotation, and pulling the scapula forward as it anchors and pulls at this point on the humerus. So there is the pectoralis major. Do you have a question you want me to answer for you? Please feel free to get in touch with me. I'm at Anatomy on the Go, and you can email me at seth@anatomyonthego.com. So I will talk to you later. Best wishes in all your studying. See you later.